Hi, everyone. We're just going to wait a couple minutes, give everyone a chance to go ahead and log in. So start in about 2 minutes. All right, we'll go ahead and get started. Welcome, everyone. I'm Tom Walker. I'm the Executive Director at Encore Outpatient Services. Thank you for joining us today for our webinar series, DMV Neighbors in Treatment and Recovery, a spotlight on local resources, programs, and expertise. Over the past several months, we've highlighted providers in the DMV region to provide you with insights and resources you can utilize in your practice. Please note that this session is not eligible for continuing education credit. We will be conducting these sessions in a webinar format. All participant microphones will be muted. During the presentation, please utilize the Q&A feature to ask any questions you may have. We will have time for questions and answers at the end of the presentation. Today, we welcome Kim Reagan, who is the Clinical Director here at Encore Outpatient Services. Kim is a licensed clinical social worker and certified substance abuse counselor who is also trained in mindfulness-based cognitive therapy, cognitive behavioral therapy, dialectical behavioral therapy, and interpersonal psychotherapy. Also at LSATP. In her 13 years of experience in the substance abuse treatment field, she has worked with all ages from adolescents to seniors in various settings. After conducting research on the treatment of psychiatric disorders during pregnancy and postpartum at Emory University School of Medicine, Kim has published articles in peer-reviewed journals and co-wrote the 2006 Obstetrics and Gynecology Guidelines for the Treatment of Psychiatric, Neurologic, and Addictive Disorders during Pregnancy and Postpartum. Kim and I have worked closely together to oversee the expansion of clinical programming and services we offer to patients and family in the Northern Virginia area. Kim also works directly with our clinical team to provide guidance and supervision. Today, Kim will be speaking on the topic, helping families heal alongside a loved one in treatment for a substance use disorder. Please welcome Kim Reagan.
Thank you. I need to share my screen here real quick. Okay. So today we're going to be talking about helping families healing while one of their loved ones is in treatment for substance use disorder. I did choose the title kind of carefully. We're helping them heal alongside of their loved ones, not on top of their loved ones, basically. So the first thing I want to talk about is what is actually gained by someone going to addictive treatment for addiction. They're going to learn knowledge of the disease of addiction, what relapse looks like, what their triggers are. Often they're going to treat not only the addiction, but underlying comorbid mental health disorders. If they begin at the top of the continuum of treatment, they're in residential treatment. They are immersed 24 hours a day in recovery. They're learning to connect not only to others, but also back in with themselves. And they're receiving therapy. They're learning coping skills. They're learning ways to communicate, set boundaries, and new ways to take care of themselves without having to turn to substances. During this time, family members feel pretty safe. Generally what I hear is, you know, once my loved one was in treatment, I had the best night of sleep I've had in a long time. They are you know, often they'll come to support groups like the one that we run at Encore, and they'll talk about how great it is to hear, you know, their loved one feeling confident and, you know, feeling like they can, you know, see their future at this point. This is all great. The sometimes scary part of this is it can lull our families into feeling like everything's okay. They might feel like, look at this, you know, my child, my spouse, my sibling is away at treatment. Everything has calmed down here at home, and once they get back, everything will be great. Unfortunately, as we know as professionals, that's not always the case. Actually, not generally the case. And, you know, when family members don't do their own work, we have trouble. So why treat the family? When we do work with clients, we send them back home, whether they're living with families, interacting with families, whatever that looks like. We send them home to potentially problematic patterns that have been there for a long time. So while we have spent a lot of time doing all the things I just went over in the last slide, teaching communication and problem solving and coping skills, they come back to patterns of communication and dysfunctional interaction that are far more laid, permanent, and pervasive than what we've just laid down in, you know, 28 days, 90 days even. So they come home to families who are now fearing, what does this mean? My loved one's coming home. A lot of fear-based behaviors, walking on eggshells, I hear a lot, wondering what their role is now in their loved one's treatment. There's also resentment. Resentment at the things that have gone on, the things that happened during active addiction. I actually spent recently an evening with our family group talking about trauma. They wanted to understand trauma from the addictive person's standpoint, but they also felt like they had experienced a lot of trauma. And we actually reviewed the criteria for PTSD, and they realized they really didn't meet that criteria, but that they did have trauma responses to familiar behaviors, trauma responses to family members returning home, and resentments around their family member who has been addicted not displaying the correct amount of regret or apology. So for the addictive person that's returning home, who we spent all this time treating, it is often very difficult to maintain the gains that they made when they walk into familiar issues. So we talk about parallel symptoms. I know that this is something that we talk about a lot as professionals, or I assume we do. There's publications around this, but I want to talk a little bit about it because oftentimes the treatment that we prescribe for families is an abridged version of what their loved one is getting. We may direct them to Al-Anon or Nar-Anon or Families Anonymous. We might send them to support groups through their treatment facilities. I did a quick Google search just on family support just to see kind of what families are seeing out there. And what I saw a lot of was learning the signs of relapse in your loved one, learning to know what their relapse prevention plan is, learning their recovery program so that you can spot when they have a misstep. And for us, we don't encourage that as much because what I have seen when we encourage family members to be hypervigilant, first of all, they don't need encouragement to be hypervigilant, but when we encourage them to monitor their loved ones, it puts them in a role that they don't belong in. And it keeps them from doing their own work. So going through the symptoms, if we are encouraging our family members to monitor the addicted person or the person in recovery, then we are encouraging preoccupation, this addictive behavior. So family members with their intrusive thoughts about the addictive person, they're unable to focus often at work, thinking, you know, where is he? What's she doing? Who's she with? Has she relapsed? So encouraging those dysfunctional patterns. The next one is increased tolerance. So the addicted person ends up needing more of the drug in order to get what they needed. The family members are more tolerant, more permissive of the addictive person's behavior. A lot of times when someone returns from recovery, this looks like walking on eggshells so they don't feel responsible for a relapse. I often hear family members say, I don't want to mention, some controversial topic, or even say like, he frustrated me today, because of a fear of triggering a relapse. The loss of control. So for family members in this context, there is a loss of control over emotional reactions. They're often, behaviors become more extreme. I had a family member who told me that she would drive over to her daughter's house after she returned home from treatment to sleep in her car out in front of her daughter's house to make sure she didn't leave the house or didn't, do something stupid. So this doesn't change all the time, and actually sometimes becomes worse as they see the light. They see their family member who's coming home from treatment, and they're getting them back. They have the old person back, and this fear of losing that. For craving, it's clear for the addicted person that physiological response to being exposed to a trigger, exposed to their drug. I had one tell me the other day that he walked into a room and there was a smell in the room that reminded him of using cocaine, and he actually had the hyperarousal, the increased heart rate, salivation, just all these things that he had when he was under the influence. He even could feel it in his back of his throat and his nose. For family members, there's this psychological craving or desire for the addict. This fear, I mentioned fear-based behavior, this incredible fear of, if I don't do everything right, or if I, maintain this boundary, if I hold this boundary that I set before, I'm going to send them over the edge, and, I'll lose them forever, whether that's to death or to just leaving me. So this craving or desire for the addict overrides holding a boundary. Compulsive behavior. So again, if we are encouraging our family members to monitor their loved one and make sure they stay on track, we are encouraging this kind of compulsive behavior, going through their phone, checking behind them, questioning, and even, as their family members are not addressing issues, not talking about what's going on, emotions build up and they need the outlet, the anxiety builds. And a lot of times family members can develop compulsive behaviors as well, compulsive exercising, cleaning, things like that, just as an outlet. And then later stages, the decreased tolerance. So family members here are, this happens right before they go to treatment. They're less likely to stay in denial, experience that emotional bottom and I can't stand it anymore. This also happens after they return home, at times where they are on eggshells, being careful about what's going on, and then something happens and there's an explosion. And then medical problems. So we need to encourage our family members to address their own self-care, take care of themselves. They have oftentimes developed some sort of stress-related health problem. Often, when we're overstressed and hypervigilant, our immune system isn't functioning, and we're more apt to get sick. So again, if we encourage our family members to focus on the addicted person, they are not able then to focus on themselves and find their own way through recovery. All right, so the programs for families are teaching them to learn the signs that their loved one is about to relapse. When I run the family program, oftentimes, somebody mentioned in one of our groups that their loved one had a relapse prevention program and they actually shared it with them. And then it just took off like fire, and everybody wanted to know what their loved one's relapse prevention plan is and how do I get involved in that and how do I make sure they're following it. The idea is pretty good. We want to be able to help avoid a relapse or stop it quickly, but the assumption is that we can. And oftentimes that's not in their power to stop that, because if they could, they already would have fixed everything. And then the downside we talked about, to asking families to focus more attention on their loved ones. So again, they take on the role of monitor. This encourages hypervigilance, encourages them to continue to notice. When we work with families in our family program, we talk about being able to weaken the association, their own triggers. I have one wife who her husband used drugs in the basement, and Still, when he goes near the basement door, she gets anxious and she becomes hypervigilant. So we talk about breaking those associations and not increasing them. It also keeps the family members focused on the addicted person, as we talked about. It is important for them to do their own healing. I had a family member last night talking about how he was able to go through therapy, learn that he needed to focus on his own joy and his own happiness, and that in the process of doing that and learning how to manage his own anxiety, he was noticing the interactions within the family system were getting better. Even the interactions with his son, who was the identified addict in the family, were improving. And at the same time, he was increasing his own happiness. And then the last is just becoming overly involved in their loved one's recovery program. When loved ones become involved in the recovery program, it can create some resentment. I've had some, actually had one client whose husband wanted to have a big calendar with a list of all of the recovery meetings he was going to, all of the times that he was going to be speaking to his sponsor, so that he could keep track. And he wanted the person in recovery to check off each thing that he had done. Obviously, we discouraged that, and that didn't happen. But that is, that could have created a lot of resentment for this particular person. And at times they'll actually just abandon their recovery program due to that anger and frustration. So we encourage parallel recovery. And as counterintuitive as it sounds, when families allow the person to manage their own recovery, it goes well or better. We encourage them not to problem solve. And so taking a step back allows that family member who's been dealing with addiction to build their own resilience, to exercise their own coping skills, and then ultimately to take responsibility for themselves. Family members who are able to do their own inner work, as I said, report improved relationships within the family system, including with that addicted person. What does that look like? So we encourage family members to learn about enabling behaviors and to examine their own behaviors in that context. When family members are coming to our group, I'm assuming that they are open to looking at themselves and looking at what they can do to improve themselves and their family system. So we talk about enabling behaviors and encourage family members to get very real about, how is it helpful to not hold a boundary that I've set, or how is it helpful to allow my addicted child to live in my basement rent-free, and at times even buy them and supply them with their drugs and alcohol in an effort to keep them alive, but actually enabling their addiction to continue and worsen. So we try to get families to be very real about this and to understand that, and learning to set their own boundaries. We teach ways to communicate, open, direct, honest communication, which really is not able to function in an addictive environment where everybody's walking on eggshells. And we encourage assertive communication for family members under the idea that when they're assertive, they are not only respecting their right to express how they're feeling, but also respecting their loved one's right to in how they receive that information. We encourage them to communicate in ways that what they're saying is actually heard versus just creating more conflict. We encourage them to learn new ways to solve problems. If we can do that in the groups we run, we do. Obviously, this family therapy or individual therapy is really helpful here. But learning how to talk about problems, how to approach problems, and really learn how to solve those things together as a family system. We provide guidance and support around setting healthy boundaries, making sure those boundaries are realistic and enforceable. So the last thing we want a family member to do is say, if you relapse, you're out of my house, you're out of my life. and not actually mean it. So we do spend some time also talking about realistic enforceable boundaries and how that looks. It doesn't have to be a black white. If you use, you're out. It can sometimes even just be, if you have a relapse, we need to sit down and have a conversation about next steps. So I think families forget or don't see the gray area. So sometimes it's helpful for us as professionals to be able to show that. We encourage family members to pursue their own therapy. Some do, some don't. And, it's not for everyone. And we also talk about the recovery process looking different for everybody, but doing some kind of work on your own. And that might be involvement in support groups. So we do encourage involvement in support groups. Caron has some support groups. We do ours. We have families who attend multiple support groups. Al-Anon, Nar-Anon, Families Anonymous. Have one who's doing NAMI. So lots of support around them. And then finally for the families is identifying and re-engaging in their hobbies, their passions, things that make them happy. Being able to turn the focus off of the addicted person and back onto themselves to be able to rejoin this family system in a healthy way. We do talk about relapse. We do actually qualify it that, we'll talk about signs of relapse, but we want to make sure that it doesn't mean that you are focusing on your family member. But they are very, very fearful of what happens when their loved one relapses. Unfortunately, when they get fearful and when they start seeing signs, this often leads to behavioral relapse in them. So any progress that's been made can oftentimes fall off and then old patterns emerge because everybody's in survival mode. So it's helpful for us to start to talk about what's your plan if there is a relapse. Developing that plan with the family. What are their boundaries? Again, enforceable, realistic. Is it that, you're going to require treatment if there's a relapse? Is it that you are going to require them to leave? Is it, again, a conversation about what next steps are? What are the boundaries? What are the consequences? And then really important is making sure all the family members are on the same page and are willing and able to follow that plan. So it's really not helpful if we have two parents, one who's willing to hold a boundary and the other who's not. So communication again, working with family members, helping them do that work, walking them through what that process looks like. I always teach people to assume the boundary will be crossed. And what does that look like? How are you going to respond? What's realistic for you? I find working with the families really, really rewarding. They are incredibly open. Usually they are really looking for answers. I hear constantly the question, what is my role in this? What is my role in this? And very specifically ask questions about, how do I get them to apologize or to understand what's happened? How do I get them to, really engage in treatment? And some of it is teaching them to let go, to, their loved one is in treatment. They are, that treatment program is addressing their addiction, is addressing most of the things that you're concerned about. Now it's your turn, you take care of you. So family members are enjoyable, and the work is rewarding. And I think that is my last slide. Yes, so I'm going to stop sharing.
Yeah, and for anyone that has questions or comments or wants to engage, please, the Q&A feature at the bottom of your screen, at least it's the bottom of my screen, feel free to jump in there, and then I will read what you've written, and we'll chat about it. So thanks, Kim. The question that comes, and this is, from doing this work and the long game here, right? So the first question I have is what are we really looking for in terms of outcomes for family? Like what's the big picture goal for family members or loved ones?
I think, long-term, improved communication. What I see is the biggest issue. If family members are able to talk to one another, they can identify an issue and they can tackle it together. They can solve the problems. So I think improved communication is a big one. ultimately, I think if we look at a family system, the ideal is to have, a group of people who work together, but have their own identities, have their own interests, have their own functioning, and aren't, this like enmeshed system where when one is having a bad day, everybody's having a bad day, where they can really function independently together as a system.
And, God forbid, but sometimes it happens, or, it's a long process, but, what does the healthy family system look like when, I guess what we would term the identified patient in a lot of cases, the person with the substance use disorder continues to use or is not responding to treatment as immediately as we'd like. So what's the healthy family system look like when the person they love is still struggling?
So I think the ideal is to support the recovery-oriented behaviors, support the sober behaviors, and don't protect from the natural consequences of behaviors associated with addiction. So, if somebody continues to use, it's, say it's a husband who is unable to, make it to the bed at night. He passes out on the floor. An unhealthy spouse would help him into the bed and cover him up and pretend like it never happened. Where a healthier dynamic is the natural consequence of passing out on the floor is you sleep on the floor and you wake up on the floor and feel horrible the next day. It might be not making up excuses for them if they miss work. So really allowing those natural consequences to happen, taking care of themselves, continuing to communicate, not participating in that denial and minimization. It's okay, it's not as big a deal, they'll get back on track, whatever. It's facing the reality of the situation. Supporting those behaviors. If they come and say, hey, this is tough, maybe I need to go back to treatment, support that, help that, do everything you can. But if they're not willing to, then you just kind of let go a little bit, that detached kind of love that Al-Anon talks about, and allowing them to feel the consequences of what's going on.
So you bringing up a couple of things. The first, I want to respond to the emotion, right? Because that sounds brutal, right? It sounds really uncomfortable and painful. So how do we support families in holding that, discomfort and living with that, that fear as, the organic consequences are being realized?
That's the real work. That's, as a therapist working with families, that's the real work. And sometimes they can't, we've had families even through our program who have said outright, I can't do it. I'm afraid that my child is going to die from this. So I'm not willing to set that boundary. And that's okay. That's where they are. And I think us as therapists, we meet them where they are. The coming alongside them and helping them to see, here's the options, here's where, here's what it would look like if you did this, here's, and just supporting them where they are, helping them to walk forward. In my experience, family may not be able to hold those boundaries early on, but they come to a place where they can. Again, encouraging that support group, or at least support community of people who are going through it also, who have been through it. And yeah, I think just validating the fear and the anxiety. I think I've said it many times to family members, this isn't easy. This is all faith. This is letting go and just having faith that you have taught them, raise them to, be able to see what's going on, and find their way back.
Yeah, and, one of the things that comes up a lot too is that, these organic consequences, when we factor in substance use disorder, could, in worst case scenarios, mean, major medical issues or, again, potentially death in some cases. And that, I think, is what drives, I can only imagine the fear, of a family member. What happens if I'm not there to protect them from the worst, right? So again, That's not a question there, I don't think. I mean, it's an acknowledgement that, also, I don't know. Let me ask in the question. What do we do with that? I mean, can we be, firm there? Are we, black and white about, no, like, let it happen? How do we kind of manage that level of fear and that level of concern?
Yeah. So again, validate, acknowledge. We talk in our family program about regulating your nervous system, the flipped lid kind of idea of going into survival mode. And we talk about how when you're in survival mode and you've kind of disconnected from your cortex, you're not making good decisions anyway. So the importance of being able to pull your system back online and think clearly and be able to make decisions, to use the supports to help with that. But there's nothing easy about it. Yeah.
You mentioned too, which I think, again, in my training a lot with community reinforcement and family training, which is more of an intervention style than a clinical approach, that there's a family goal, right? That is, identifying help, right? And saying that this is the help that we'd like to see our loved one take, and that ultimately is usually the primary goal for the family, and that the outcome is kind of left to the professionals or what that person's going to do. So if we can sit with the anxiety and continue to say, set boundaries that are appropriate and let consequences happen, and have the conversation at the right time when someone's receptive that, treatment might be a good idea. I'd love to see you. I'm concerned about you. I'd love to, see you at your best. And, that's a pretty, it's not an abrupt intervention, but it's a way to help motivate someone forward, because if you're using substances and you're out of control, you have a problem. You may not admit it when you're in the worst of it and the symptoms are at the worst, but ultimately, we don't have anyone show up in treatment that doesn't, at least on some level, want to work on something and have something improved in their life.
Mm-hmm.
So again, there's not a question there. I just putting that out there. So Mark Servatius, who does a lot of work with individuals in our community. Mark, don't let me misrepresent you, but a lot of coaching, a lot of sober support. Has a great question, saying one of the biggest challenges, are there tips for getting families to engage mutual support groups beyond the family support group? And Mark, I guess I'm taking that outside of the Caron family support groups and the Encore family support groups, the treatment style family support groups, or yeah, the mutual family support groups outside of family support group. Any tips for motivating?
So I know what we've done in our group is we've had the different family members who are engaging in outside supports, because some of them have come to us. They've been in, they've been through it with their loved ones, so we're not their first rodeo. So they've already engaged with a lot of that stuff. So we will actually use them to talk about it. Like, what's the benefit to you? What are you getting out of, attending Al-Anon or attending NAMI or whatever it is you're doing? And so they actually are really good advocates and really good sources of information and encouragement. We have some who are doing individual counseling. So we actually had this conversation last night about individual counseling and what's the benefit there to me as a family member. Because we definitely have well, I don't really have the problem. I just want to learn how to deal with the problem. So the idea of making that jump into other arenas outside of I'm just attending this support group because my loved one's in treatment here is definitely agreed. It is a challenge, and often their peers are really good at talking them into it. If we don't have that, if we haven't even gotten them engaged in the support groups that we offer, then it's, we engage them in family therapy sessions with us, where we talk about, prognosis, and the prognosis here is improved if you're able to attend things. So we kind of, if we can get them in front of other people who are doing the work, we'll do what we can to do that and be able to use them as a resource, if that answers the question.
Yeah, I think that was actually a great way of answering it. And it brought up that it's really the same thing for the individuals with the substance use disorder, that asking them to go to some type of mutual support meeting without any context of what it's going to be like, or without any familiar person that's there, or a sense of, buying into how it might positively impact us. It's going to be a lot harder for them to go. Right. And so
Mm-hmm.
folks that have already been there, that have already developed rapport and trust, that can relate directly to the other family members, are going to be probably the best messengers for that.
Yeah, absolutely. Mm-hmm.
Great.
Yeah. And sometimes they'll even, um, say like, hey, I'll go with you, especially now with everything being virtual. They'll be like, yeah, I'll meet you there, so it's even beyond that helpful.
Yeah. Yeah, and I would say too, encouraging folks to bring it up too, if it's in that, back there, because like, um, these support groups exist free of charge, and they're not exclusive, right? So when I'm talking about the support groups, most of the treatment centers in the region have some version of a support group. And of course, we're um, partnered in, ownership with Caron and Maryland Addiction Recovery Center. Both have support groups. The Caron support groups are, pretty incredible, and they're not exclusive, right? So even if it's a matter of starting out there, and then letting those groups take hold and say, here's what's working, and guide folks, I think that's a great opportunity.
Mm-hmm.
Another question from Sarah, who, again, we keep talking about the Caron family support group. Sarah, of course, facilitates and really takes care of the ones in our region, is a great advocate for families. How many weeks do you expect a family would be engaged in your family support meetings? Is it a parallel process to their loved one's treatment with Encore?
It can be. We actually have several family members that have continued to come, even though their loved one has finished treatment. It's been a great resource to the other people who are, newer coming in. They get to hear from, the loved ones that have, kind of progressed in their recovery. They get hope from it. And the family members who have stayed with us actually sort of take on a mentor role with the others. So I guess that's a long way to say we don't really have a set right now end date with this particular group where you're not welcome to come anymore, or you're done, you've graduated, you finished, because truly it is they have really taken it, these family members. We have great family members. I don't know how I got so lucky, but they have really taken it and created this mutual support for each other. And I mean, they show up every week. So, yeah.
Yeah, and there's different, you brought this up in your presentation. So there's different kind of tiers to support, right? I mean, there's actual treatment for family therapy, multifamily groups. There's support groups. They're all these different things. I think more traditionally, the clinical family treatment, family therapy, multifamily groups um, occurs during the course of treatment, right?
Mm-hmm.
As a unit, right?
Mm-hmm.
Uh, and then the support groups are ongoing. Um, and I think the support groups have become even, increasingly popular too, before folks are comfortable going to some other type of, Al-Anon or what have you, because I think the barrier to entry is a little bit easier. There might not be, any like bias, or kind of like some of the negative opinions that exist out there, and then by going, it helps break down that bias and negative opinions to do more. Um, so yeah, it was a great question, from Sarah. I mean, family recovery doesn't stop, right?
Mm-hmm.
It doesn't stop.
Mm-hmm.
The person
Yeah.
with disorder, family recovery is going to be ongoing.
Mm-hmm. Yeah.
Uh,
Yeah. And I like that you brought up the what we're doing right now is really just support based. group. So peer support, facilitated. We do some psychoeducation. We do spend time teaching them to focus on themselves. So we do mindfulness, we do, anxiety management, stress management, things like that. But there's also, the opportunity for engaging, loved ones, the person in treatment with the family in a family setting, family group setting, and being able to use that as a resource as well, which, like you said, I think would be more treatment, like during their time in treatment, they would engage in that. So yeah, different levels, different requirements, different timelines for it.
And I'll kind of use that as a place to plug for, the professionals here and some of the family members, that we will be starting a family education series that is, again, another partnership between Encore, Caron Treatment Centers, Maryland Addiction Recovery Center. It'll start on the 23rd of this month, and it'll be the 23rd, the 30th, and then October 7th, followed by a all-day family education program on October 10. And the goal of that is to really get a little bit more into the nitty-gritty and work with families and provide content directly for families pertaining to their own recovery. Because during COVID, or really I think in treatment in general, there may not be enough attention to the family system. And again, that was actually something that came up in conversation with Sarah and has become something we hope to do on a continuing basis. So Jerry from Westbridge is saying, at Westbridge, we have found that having a formalized mentoring program for families asking family members who have been with us for a while to sign up to serve as mentors for newer family members is highly effective in helping some family members be more engaged. It works somewhat like sponsorship in AA.
That's pretty creative.
It's a phenomenal idea.
Mm-hmm.
Getting people more plugged in. Kim, let's talk about that long-term recovery for families too. I mean, what is, back to kind of, Sarah's question and us saying, this is open-ended, and them saying, well, recovery is kind of never ending. What does that mean? Like, what does this really look like?
Well, I mean, if you ever go to an Al-Anon meeting, there's people who've been going to those meetings for years and years and years, and they've really built a network there. And similar to the person who's, going through recovery from addiction, they keep those supports to sort of keep themselves honest, keep on track, don't stray from this recovery program that I've created, and, these new habits that I've established and formed. It's similar. I mean, I think of the stages of change with addiction and with family, that maintenance stage where, you've built these habits and now they're sort of, just part of it, but you have to, keep yourself immersed in this in some way, to keep those habits in place, not go back to old behaviors and old patterns.
Break that down a little bit more for me. Can you do the overlay of stages of change as it might apply to family system?
Sure. So stages of change, starting with pre-contemplation. There are obviously people who seek treatment, not quite as often in that stage, but sometimes they're coming in saying, well, I don't think I have a problem. This is no big deal. And I totally wouldn't be doing anything about it if my wife didn't have an issue with it. So that's more of what will show up in treatment, of somebody who's in the pre-contemplative stage. For family, what I hear is, oh, it's just pot. It's really not a big deal. I'm not sure how all this has happened, or he just drinks a little bit. It's no big deal. So that's kind of that family pre-contemplative stage. And at that point, there's not going to be a lot of change. Any change will be short and fleeting at that point, and really just based on external pressure. We move into contemplation where, okay, maybe there's a problem. I'll acknowledge that, but I'm not really ready to do anything about it. So for families, it's, they enter this world of, realizing there may be an addiction, there's a substance use issue of some kind in the family, and they get exposed to this recovery world, and it's overwhelming. and they don't feel ready to actually step into that. So yes, I acknowledge there's a problem, but I just don't think we're in a position to do anything about it. And we move into preparation. So a family might have at this point, yes, I notice there is a problem, there's something going on, and I'm a part of this problem potentially. I need to make some changes too. And then they start making plans. So they're seeking out, where are the Al-Anon meetings? Does this program have a support group? Do I need to get individual therapy? Who could do that? So they start making preparation and plans to do their own stuff. Meanwhile, the person with the addiction in that maintenance stage is seeking out treatment, seeking out support groups, things like that, but haven't actually done anything. So then we get into action. And it's funny, whenever I talk about the action stage of stages of change, specifically with people with addiction, they will always tell me, oh, I'm in action stage because I go to, I attend group, right? So I'm in action stage. And what they forget is part of the action stage is the idea that there's a great deal of effort being expended on this. So just checking a box is really not action stage. And that also goes for family members. So showing up at the support group associated with your treatment program and just sitting on mute in a Zoom meeting really is, you're there, but it's not really action stage. So this asks for some effort. Family members to start putting that plan that they've just made in preparation stage into action. So if it's, I really need to address, our communication style, so let's engage in family therapy. Or, let me go to this meeting and see, what that's about and how I can really step into this and allow this to come inside and make some changes that I need. Starting to make different choices, starting to make, not have those same knee-jerk reactions to familiar behaviors from their loved one, and actually having conversation, communication, and engaging in problem solving. And then that maintenance stage, like I talked about, it's where those things are now becoming part of life. So effort has to be made to keep it there. And then, the last stages of change is relapse, unfortunately. It's sort of that like floating out there, not required to happen, but does. So again, like I talked about in the presentation, having some sort of plan for how to get back on track.
Thank you for doing that. And there's a question, I think it relates quite directly. How do you work with a family who minimizes the drug use? Everyone drinks in college, right? So a family that's, pre-contemplative. Really, the question for me after the description you just provided is, how do you help move them through the stages?
So pre-contemplative is tough. Like I said, there's not a lot of acknowledgement that there's even an issue to be addressed in the first place, right? So it might just be presenting information. I find that people in that pre-contemplative, contemplative stage, if you push too hard, they're leaving and you've lost them and there's no chance. So kind of carefully just presenting information. It might be, we talk about motivational interviewing and rolling with resistance. So it might be just posing a question in such a way that challenges, some inconsistency or something that just doesn't make sense, but they're basing the idea that there's not a problem. So everybody drinks in college, and it's, a lot of times there's data saying that's not okay, so kind of being able to point those out without being confrontational, I think, and providing information and options and letting them make that decision.
Thank you for that. There's Sarah again. I'm going to read it verbatim. So the preamble to the Caron Family Support Group encourages attendees to also try a 12-step support group. Over the weeks when I sense a family is resistant to 12-step format, I'll share that I've been attending Al-Anon for 14 years and how I expect to attend for the rest of my life. This comes as a surprise to some, and then I share how valuable it has been in providing me with new perspectives. And that's awesome.
Yeah, so it's that peer thing, that there's so much more power in the person who's walking the walk than, the professional brings in the room. It's, I'm paid to say what I say. It's kind of the attitude. But if you as a family member come in and say, this has worked for me, then I think there's a lot more power to that.
And there's a bond in the kind of pain that people have been through, but when individuals have transcended that pain by applying, common solution, then that bond is even tighter. So you go to, years of, seeing same people, you develop a depth of, relationship with them that, because of the recovery and not just the problem, those relationships are incredibly important and beneficial and, healing on an ongoing basis. And that's, the picture I think that we forget is that, if we keep doing this thing, it turns into something so much more. Jerry's asking, is there an intervention model for assisting families not following their loved one into relapse so that the family stays consistent?
So I think what we have done here is just sort of providing the information. What is addiction? What does that look like? What's happening? What are they up against? And then helping them to focus on their own recovery and kind of giving them the idea that, hey, you have work to do too, in a careful way, depending on where they are in those stages of change. So I think providing information, encouraging that focus on self, in the context of if you're able to, relate to your loved one in a healthier way and change some of those patterns on your end, in that system of family, it automatically changes things. In the function, that compensatory behavior, it works both ways. So we have those compensatory behaviors for addiction, where the family develops ways to behave that will make up for whatever the addiction has brought into the family. Same the other way. When we change that function to be, about recovery, there's also those compensatory behaviors that happen in a healthier way. I don't know if I answered the question, but.
Yeah, well, and I think it brings up an interesting point as well, though, is that, our field in particular, I think, has neglected to develop true evidence-based, structure and programming for the family system, right? Like, it's been a lot of, focused on the substance use disorder and what have you. And now the evolution is the realization that the system is as important as the individual. And yet there's still not a lot of, interventions or models that you can just kind of rattle off and say, oh yeah, this, and this, I mentioned CRAFT, community reinforcement and family training. I'm a big proponent of it. It's heavily evidence-based. It's an intervention model, that families can learn and study and adopt. There's professionals that do utilize it, but it's not utilized enough. That's one that comes to mind, and I'm sure there's others that just don't come to mind, but most of what we're doing right now is a kind of eclectic approach using skills and training that have been applied elsewhere for years and years.
Mm-hmm. Yeah, I think the two that come to mind are the CRAFT that you mentioned, and then just family systems, Bowen family systems, and sort of looking at the unit and approaching it in that way.
Right, and then more like some of your traditional therapies, or things that the practices that individual may specialize in, imago, or a variety of different kind of couples work or family work that might be out there.
Mm-hmm.
There was just checking our time, kind of coming down. So back to where we were for a second. So how do you support a family when one member, maybe a parent, is actively using but in denial? So like an example, a young adult in treatment, but the parents are still using.
Tough situation.
Yeah.
So ideally, we as the treatment program, dealing with both the addicted person, the identified addicted person, and the family, we don't get sucked into those unhealthy patterns of denial, minimization, rationalization. I think just naming what's happening. I think there's different ways. I have used Claudia Black in the past, and she has a form that family members can fill out, and you as the therapist can give it to them, and it talks about other addictive behaviors, and identifying those within the family system. And so, maybe coming about it that way. But I definitely encourage open, honest. We teach open, honest, direct communication, and so I think that calling what's happening, encouraging treatment for that individual as well, and just sort of modeling, that approach, that careful but direct kind of approach. within the context of where they're at and what you're going to get, I think.
Yeah, and I think I'll add there too, and like what we do a lot here at Encore, or what, you know, coming from Caron or any of, you know, like Westbridge, or, you know, any provider is also looking at what kind of healthier living options are there too. Like, you know, the sober living, are there safe places where this person maybe can be removed from that system? Because quite frankly, there are systems that are not healthy enough to support recovery, and that are in fact like one of the primary relapse, you know, triggers for someone trying to stop using substances. So in a lot of cases, a complete removal from that system is necessary.
Mhm.
So,
Yeah.
well, Kim, you know, I want to thank you very much. Of course, it's a really, you know, an honor and joy to work with you, and I appreciate getting to do so. And it's nice to kind of chat and showcase a little bit of what we're doing here. So thank you for your time. Thank you for your presentation. And thank you to the rest of y'all for joining us today. Next week, we look forward to welcoming back Alex Ribbentrop. He will be providing a special 2-hour webinar on the topic, Breaking the Cycle, Understanding Personality Disorders and Intergenerational Trauma in the Treatment of Substance Use Disorder. Webinar will provide 2 continuing education credits through the American Psychological Association. Alex's presentation on this series just had so much opportunity to dig deeper that we wanted to have him back and really do a deeper dive on the topic. So I'm excited to have that and offer those 2 CEs. Registration's open for that webinar using the link on your screen. We will send out an email with additional details. Also, this presentation and all previous presentations are available on Caron's YouTube channel, and will be sent out and available for you should you wish to see those. Please feel free in the meantime to reach out to myself here at Encore Outpatient Services, Mallory Schwartzman at Maryland Addiction Recovery Center, Jess Ayer, who represents Caron Treatment Centers in Maryland, and James Flenche, who represents Caron Treatment Centers in the District of Columbia and Virginia. Thanks again, everyone, for attending. Have a great afternoon.